So I just wanted to start off with something very simple that I did upload to our school's kind of group website. So, I mean, Facebook page, I'm sorry. So, this one is something that you can print off. It should be in PDF form. It's the cranial nerves. And so, on the left side, you'll see cranial nerves commonly tested on. They'll be listed in Roman numerals and not by name. And that came from Leak. But I can tell you, since taking boards on May 15th, that is very much the case. Some people learn by just memorizing, cranial nerves is the olfactory nerve, or cranial nerve 2 is the optic nerve. Some people learn best by remembering, certain songs or certain mnemonics, which I did list up here, which is how Leek has in her book. And then over here is cranial nerves 3, 4, 6, 9, 10, and 12. But what I did was I took the cranial nerves and kind of made it colorful. And also I made it to where, for people who are visual, like myself, and people who need not only just a visual, but also the words to see, and maybe to carry around with. This is what I made it for. So, cranial nerve 3, which kind of represents the eyebrow. So, this is supposed to be like a face. So, cranial nerve 3 is represents kind of the eyebrows, and it's your oculomotor nerve. And so, whether that's raising the eyebrows or, whatever that is, you can kind of put that two and two together. Cranial nerve 2, and I have the little eyes, is for the optic nerve. And so with the optic nerve, you're going to be testing using, say, the Snellen chart, which is why I put the Snellen word there. And then cranial nerve 5 is your trigeminal nerve, which represents here kind of like the center of the face. In addition to cranial nerve 1, which represents your olfactory nerve. So I put that there as well. And then moving on to cranial nerve 4 and 6. So commonly seen on boards, they do test commonly one seen are cranial nerves 3, 4, and 6, which are kind of grouped together. And in the question, as far as the wording, they're going to give you a scenario and they're going to be asking for, cranial nerves. And so you have to be able to basically say, oh, okay, cranial nerve 3, 4, and 6 are the trochlear abducens and the oculomotor. Well, they may not say that exactly as far as those words, but you need to know how to recognize which ones are which. So just be clear on those. Of course, cranial nerve 8 is the acoustic nerve. And so with acoustic, you're going to be doing the Rennie and Weber test. Cranial nerve 11, which kind of represents the shoulders, are the spinal accessory nerves. So like the shrugging of the shoulders, things like that. And then also cranial nerve 9, 10, and 12 are the hypoglossal, pharyngeal, and vagus nerves. So I kind of represented that with the tongue, obviously. I didn't see that on my test, but there may be some. I mean, I know they have different versions, so you may want to just familiarize yourself with those cranial nerves. And so if you find it on the PowerPoint, just print it out. It should be very helpful for you. That way you can visualize, what the cranial nerves are. And one of the things that I found personally when studying for boards, it's not so much trying to memorize, I'm sorry, the information. That's where we go wrong. Standardized test is, where we're at in our career as far as testing. Standardized tests are not about memorization. Yes, I can remember cranial nerve 2, I can remember cranial nerve 8, but it's not about just that. They want to know, can you put that into, if I put this into a scenario and give you a question, how are you going to be able to pull out that answer? Are you going to be able to assess to say, oh, she's referring to cranial nerve 8 or the acoustic nerve, or cranial nerve 8 is what you use to, or what you're assessing when you do the Rennie and Weber test, or you know, my patient is shrugging their shoulders, what is this representing? Well, that's representing, your spinal accessory nerve, and that's representing cranial nerve 11. So it's not so much about, when we were in, say, nursing school per se, or even in grades, K through 12, the standardized testing is going to test us on what is cranial nerve number 2, and then I'll go A, B, C, and D. Well, that's all they're going to ask. That requires you to memorize things. The way we are in our career as far as testing, we're beyond that now. So you have to kind of change your thought process when you're studying for boards. That's one of the main things that I learned and that I kind of veered away from, as far as like your standardized testing. So there's some things that I can kind of put up there for you guys if you would like to kind of show you ways to pull out the information, which again, this kind of is representative of this cranial nerve diagram with the different colors, the wording. It still gives the person the option to learn with mnemonics. It gives you the option to learn with memory, as far as like just learning cranial nerve 2 is the optic nerve. But it also gives you that visual so that when you are taking a test such as the boards, it's about recall. And so that's the really big challenge for people, is learning to recall that information. And so if you can learn what these cranial nerves are and be able to recall the information, then you will do well on the boards.